We've been dispatched to this apartment complex. The elevator's out. Now we have to climb all the way up the stairs to find our patient. She's a 17-year-old female that's facing a lot of anxiety today. So she called the ambulance looking for an assessment, someone to talk to. We'll bring our gear up along with us and we'll just have a chat with her. So this video is about going through an OPQRST and sample history. Let's take a hike up the stairs. Every single time people are at the top of the stairs. Okay, I see her. All right, we'll gently approach her. Like any call, we gotta make sure the seat is safe. There is no danger to us or given to the dispatch center. He said no need for police on this call as she wasn't trying to harm herself or anyone else. Let's go have a discussion with her. Of course, I'm forming my general impression as I approach. She looks mildly distressed. She's holding her head. Skin color and condition, slightly pale, but she doesn't seem to be working hard to breathe. All right. Hello, we're paramedics. We're called to help you today. Before I start to interview my patient with OPQRST and sample, in this situation, we're going to assume that I've delegated my vital signs to my partner, so they're going to come around and take blood pressure, and take a pulse, maybe put them on the monitor to get an SpO2, also take a temperature, maybe a 4-lead, and I'm going to go into asking my patient those questions. So in this scenario, we're going to assume that the airway is patent, breathing is adequate, circulation is fine as well, and let's just go on to our topic of an OPQRST and sample history. Hi, my name is David. So as my partner's taking vital signs and stuff, if that's okay, I'm just going to ask your name. What's your name?
My name's Montana.
Montana. It's nice to meet you. We were called here today. You were dealing with some anxiety. As we're taking vitals, I'm just going to ask a few questions, if that's okay. All right. When did your symptoms begin today? What were you doing when all this began? What's happening today?
I was just cooking some food and it kind of came upon me. I was pretty short of breath and my chest starting to tighten.
Okay, so if you have some chest tightness, does anything make that better or worse right now, or is that pain kind of constant?
Well, it's not that bad, but when I breathe, it feels super constricting.
Okay, what if you were to move your arms or anything? Does that make the pain better or worse?
No, my arms and my everything's fine.
Okay, excellent. Can you describe in your own words how this sensation feels that you're having in your chest?
It feels like something's really, really like heavy on my chest.
Okay. Does that heaviness or any type of weird sensation go to your fingers or radiate into your jaw or anything like that?
No.
Thank you. Can you rate the way you feel and that pressure between 1 and 10? 10 being the worst pain you can imagine. I don't know if you've broken your leg or something, but compare it to the worst pain you've ever felt and maybe give me a number.
It's probably around a 2. It's not bad, it's dull.
Okay, and what's the worst pain you've ever felt before?
Well, I split open my head before and that was really bad.
Okay. So, I get this right, you were cooking. This happened about 20 minutes ago, is that correct?
Mm-hmm.
All right, and you developed the shortness of breath and chest pressure. You're not having the shortness of breath right now, are you?
No, I'm okay. It's just hard to breathe.
Okay. All right, well, if it's a little hard to breathe, I could instruct my partner to give you a little lead oxygen if you require it.
No, I don't.
Okay. All right, we'll put that off for now. We'll find out if we need to when he gets his vital signs. I'm just gonna ask you a few more questions now. For example, are you allergic to anything?
I have a food allergy to pineapple, but nothing else.
So you're not allergic to anything environmental or any medications or drugs or anything?
No.
Do you take any medications?
I used to take one for anxiety, but I've started to go off of it for healthy benefits.
Okay, all right. So you're not taking that medication right now, so you're not compliant with that medication?
No.
Do you need to take any non-prescription medications, anything over the counter, like Advil or Tylenol?
I do take Advil.
Any herbal type medications?
No.
Okay, and I'm just gonna ask you a confidential question. Do you take any recreational type drugs, like off the street or
I
anything
do
like
smoke
that?
sometimes.
Like cigarettes?
Yeah.
How many cigarettes would you smoke a day?
3.
Okay. look at some of your medical history. Have any like neurological problems? Ever had a seizure?
No.
Stroke? I know you're quite young. It's very unlikely.
No.
All right. Nothing when you were very young? No seizure-like activity? Excellent. What about heart problems? Ever hear of anything called angina or CHF?
No, I haven't.
Haven't had any of those type of problems? Any heart problems in your family?
It's very unlikely.
Okay. What about respiratory problems, like breathing problems, like asthma, or if you've heard of COPD?
Well, no asthma.
You ever felt the shortness of breath like you've had today before in the past?
Yeah.
And what was the reason you experienced it?
Anxiety, I think.
Okay. All right. Like you said, you were on medication for this before. What about abdominal problems, like maybe Crohn's or irritable bowel syndrome?
No, I don't have those.
Never had
problems.
irritable bowel syndrome? Like problems with your belly when you get anxious or tense?
Oh, well, my stomach does hurt when I'm tense, but nothing like that.
Right. Any nausea or vomiting right now? Like feel like you're gonna throw up?
No, at the beginning I felt like I was going to, but it passed.
Oh, excellent. Oh, okay, that's good. Well, things are getting a little bit better. What about your last doctor's visit?
I don't even remember my last doctor's visit.
No surgeries or anything like that
No.
recently?
I went to a clinic to get my last prescription a while back, but that's it.
Any diabetes?
No.
And what about in your family? Any medical problems in your family, such as cancers or anything we need to be aware of?
Nothing that could affect me.
Okay. So what about anxiety in your family? Is that something you deal with? How is your family life? Is it a little anxious and tense right now with the COVID-19 and
Yeah.
everyone having to live together? What's like school like for you now?
My school stopped, so I have to do online school, which is really stressful. It's a lot more work than I expected. My parents are really anxious with their jobs.
Okay. All right, so you are dealing with quite a bit. What about the last thing you ate? I just want to get curious about the type of diet that you're eating and if you have an appetite or
I
not
ate a
right now.
sandwich.
So you do have a bit of an appetite?
Yeah, I was cooking, but I didn't get to finish my next meal, so the sandwich was a while ago.
Okay, no problems using the bathroom?
No.
Not using the bathroom more than normal or anything like that?
No.
Okay. So, anything else you would like to tell me today about how you're feeling or what's going on? And you're looking to get some help for that today? Do you want to get transferred to the hospital, or we can maybe make an appointment with your family doctor to avoid a visit to the hospital right now with
I would like that.
COVID-19 taking place? We can give you a number to call, which is 811. It's going to check out my vital signs that my partner has, and we'll go from there. Just make sure that there's no concern with your vital signs, all right? All right. Okay, everyone. It's not more complicated than that, so make sure to document your findings. This is just a small portion of the entire patient assessment. Look at the other videos that have to deal with arriving on scene, taking your vital signs, and at this point we kind of come to a differential diagnosis to try to understand the problem that she's having today. We rule out any type of cardiac cause with the pain that she had, and we've come to the conclusion that it is an anxiety call. So we'll give her the resources that are available to her, and we'll help her out best we can. Thanks guys, check it out. Thank you for watching right to the end. Like this video, and we'll see you in another series of videos to come and practice in the lab.